Hey folks, welcome to the 65 Brief, where we explain Medicare in plain English. And today we're starting with one of the biggest questions people have. I'm turning 65 soon, and what do I actually need to do first? And the first thing I want to let you know is this. Don't wait until your birthday month to start figuring this out. Most people, your first Medicare sign-up window is 7 months long. It's a 7-month window that's 3 months before your birthday month, includes your birthday month, and then the 3 months after your birthday month. Now, this window matters because waiting too long can lead to rush decisions, missed deadlines, and coverage that just may not fit your needs. Now, before we go any further, let's keep Medicare simple. Medicare can be very confusing, it can be very overwhelming, and I'm here to make it as simple as possible. Medicare is health insurance for people who are 65 and older, and some people may qualify earlier due to disability or certain health conditions. The main parts of Medicare are Part A, which is your hospital insurance, Part B, which is your medical insurance, Part C, which is a Medicare Advantage plan, which is a specific type of Medicare plan, and then Part D is your prescription coverage. There are also Medicare supplement plans, often referred to as Medigap, that can help pay some of the out-of-pocket costs that aren't covered in original Medicare. And this is where some people get tripped up because not everybody should do the same thing when you turn 65. If you've already retired and you're not covered by any active employer insurance, your next steps may be different than those of someone who may still be working. If you are still working or you have a spouse that's still working and you're covered under their health insurance, don't just guess. Employer coverage, retiree coverage, COBRA, VA benefits, HSAs, all these things can affect what you do next. And this is one of those times where asking, a few very specific questions can save you a lot of trouble. Now, when it comes time to actually choosing a plan, there's some boxes that you definitely want to check. So before you choose your coverage, let's check the following things. First and foremost, doctors and specialists. You want to make sure that all the doctors and specialists that you see now are still covered once you go on to Medicare. Same with your prescriptions. All the prescriptions that you're taking now, we want to make sure are very well covered by whatever Medicare plan you choose. Your preferred pharmacy, whether that's a local mom and pop shop or a big retail pharmacy, that matters. Your hospital, where you go, if something major does happen, we want to be sure that you're going to the hospital of your choosing. And your monthly budget and possible out-of-pocket costs. These are all things that come into factor and play when you're looking at your coverage options. Now, one common mistake that a lot of people make is picking a plan based on, the opinion of a friend or a neighbor. A lot of folks will say, hey, my neighbor down the street has XYZ insurance company and he just absolutely loves it. I think that's who I want to sign up with. And sometimes it can work out for you, a lot of times not, because their doctors, their prescriptions, their budget and health needs may be completely different from yours. And this is something I tell, all the people that I work with. Medicare is not a one-size-fits-all program. There is not one plan or company that's best for everybody. It's definitely case by case. Bottom line, folks, start early, ask questions, and compare your options carefully. Don't go out and pick something based on one thing. Like you see an ad on TV or Facebook, you have someone tell you about how great their plan is, low premiums, whatever that may be. You want to make sure that the decision that you make is going to work best for you. Guys, this has been the 65 Brief. Subscribe for clear, plain English Medicare education without the confusion. Thanks, and see you next time.